Hi, this is Dr. Gombele from drg.com. I'm welcoming you to our new series of health presentations in my YouTube channel. I would like first to apologize for not having the morning walk with Dr. Gombele. It's due to the fact that we're having a spike of the coronavirus and our movement in the islands are restricted. But as long as we go back to our normal movement, we will resume the morning walk with Dr. Gombele. Hola, Monamboka, Sangoboni, Monganga, Dr. Gombele. Ngamu, Losako Bukulak, Iote Kawe, Monganga, Dokotolo, Gombele. Hi, how are you? This is Dr. Gombele. Bonjour, comment ça va? Je m'appelle Dr. Gombele. Amigo, ¿qué tal? Saludos desde Jamaica. Today, we are going to continue on what we started yesterday on the stroke. And we said that stroke is when there are two things, either decrease of blood flow in the brain, or there is a bleeding in the brain that discontinue the flow of the blood in a particular area of the brain. It is called stroke. But in a medical term, we call it cardiovascular attack. Cardio, the heart, vascular, vein and vessels. So the problem really, it links between the heart and the way the blood circulates in all extremities of the body. We also said that we have three types of stroke, as I indicated earlier. One is called ischemic. That means there is no blood, there's no bleeding, but there is decrease or complete reduction of blood flow in a specific area in the brain. And we also have hemorrhagic stroke when there is a bleeding. A vessel has ruptured, therefore there is a bleeding. And we also call minor stroke, or TIA, transient ischemic attack. This is a stroke that resolves within 24 hours, and it lasts very short, maybe a minute. You felt weakness on one side, in a second it goes away, and you may have episodes right through the day, and then you don't feel it anymore. But we use those as red flags. These are like signs something bigger than that, it's on its way. We also spoke about the functions of the brain. We say the brain is the master organ. It helps us to feel, to touch, to talk, to walk, to laugh, to cry, to understand, to express our feeling, to comprehend the language, to learn a language. So to breathe while we are sleeping, the heart will continue beating while we are sleeping. All these functions of the human body are coordinated from the brain. And we also mentioned the risk factors. We say that risk factors are conditions that more you have them, more likely you're going to develop a particular disease. And in the the circumstance of stroke, where we talk about the stroke, the risk factors are high blood pressure, the first one. The second, smoking. We mentioned diabetes mellitus, high cholesterol, heavy drinking, lack of exercise, and then diet. We also spoke about the signs and symptoms of stroke. Trouble. We spoke about trouble speaking, trouble understanding, numbness, arm or lower limbs. We also spoke about the trouble seeing from one eye or both eyes, some headaches, trouble walking, and we came with the word FAST, fast. When you see that, call for help. F for face, A for arms, and S for slurred speech, right? So T, you call the help. You call for help by even contacting hospital or a doctor that you know. So I invite you to like, share, subscribe, and do not forget to click the notification bell so that when I upload my very next video, you can be notified. This second section of the presentation, we're going to talk about the missed symptoms and signs of a stroke. And these are not only missed at home, in the hospital too, right? Weakness in the face, vague. Somebody will come and say, I'm feeling weak in my face. Or go home, maybe just got tired, go and rest. It's a stroke, right? You have to put into things together. This lady, if she's over than 65 years old, if she has high blood pressure, if she has all the risk factors that we have mentioned earlier, look out for a stroke. Nausea. Nausea is the feeling of vomiting, but not vomiting. This is non-specific, right? Again, the age, look at the risk factors, heavy smoker, heavy drinker, uncontrolled diabetes patient, and controlled hypertensive. So look out for the stroke. Loss of balance. You know, they get up, they want to walk, and they miss a foot, a loss of balance. They say, okay, you're stressed, go and sit. Careful. Can be a sign of stroke that we're going to miss. Slurred speech, headaches, right? These could be the signs and symptoms of stroke that we can easily miss. How do we diagnose a stroke? Depending where you are, if you come to the hospital, we are going to admit you first to the medical ward. We are going to take some blood. We are going to do electrocardiogram. We're going to do chest x-ray. When you get into the ward now, they may want to do a CT scan or to do an MRI. If they don't find anything, they may want to do an echocardiogram. So these are the imaging or the investigations that we usually do to diagnose a stroke, right? To treat a stroke is a team effort. It's not one-man show. It's a combination of doctors and porters and physiotherapists, nurses, right? But when you come to the hospital, you're going to see an ER physician, and the nurse will take the blood pressure. And right away, we're going to see the blood pressure is always all over the place. They took the glucose, the sugar can be all over the place, and they do the urine analysis. But if you're coming from a private doctor, maybe a referral to go and do CT scan, and then you go to the hospital, right? In the hospital now, you're going to see ER physician who will admit you into a medical ward. You're going to be dealing with the internist. Internist then will treat or diagnose. If you have a bleeding stroke, then the neurosurgeon will step in now, right, to evacuate, to go into your brain and to evacuate the blood. And sometimes we need to see a neurologist, but we also see surgeon. Why? Because if you are bedridden and you develop ulcer and the ulcer get infected, you need to debride the ulcer. And you're going to be admitted this time, not to the medical ward, you go to general surgery ward where the surgeon will debride. You may see a speech therapist if you have problem speaking. You may also see a physiotherapist because stroke will leave you with stiffness in one hand, stiffness in one leg. You cannot move. So the physiotherapist will try to restore your movement. So it is not one doctor show. It is a combination of doctors, nurses, and other specialties within the medicine. The last but not the least, you need to go to see a nutritionist, right? If you have never been able to control your diabetes because of the way you eat, to control your pressure because of your lifestyle, the way you eat, to discontinue smoking, right? To stop drinking, to lose weight. All these are the risk factors that we're going to be dealing with now. so that we can stop another stroke, because as you get the first one, many people get the second one while in the hospital, right? And then what we notice, the second is always worse than the first, right? So this is the team of specialists that will be dealing with a stroke patient. What are the complications of the stroke? Before I speak of the complications of a stroke, I invite you again to do what? To like, to share, to subscribe, and click the notification bell so that when I upload my next video, you can be notified. The complications of stroke are numerous. Can leave you blind, speechless, inability to control the urine, you cannot walk. So it depends on the area of your brain that you have got the stroke. And we say we don't walk, we don't speak, we don't see. By mouth or hand, the brain organizes all these movements, right? But the complication that kills most than stroke itself is bedridden. Because when patients have stroke and they become bedridden, that means they are on the bed, they cannot move. They have to be moving them, right? We realize that they develop bed sores. And then those bed sores will get infected. And sometimes we have to put a catheter so that the urine will go into the catheter. They have no control of the stool, no control of the urine, and most of the time, when they have bed sores, the stool get mixed up with the urine in the bed sore areas, and that develop an infection, and they start having fever, right? And that, if nothing is done, kills them quickly by what? Sepsis, right? So to deal with the complication, we need to have what we call egg crate mattress that help to reduce the complication of bed sores. So patient must be moved very often from one area to another area to also prevent what? The complication of bed sores. And as quickly as we can, if we can start putting patient in the wheelchair, of course, if you can afford a physiotherapist at home to try to restore as quick as possible the movement of the limbs that are affected, it will help. So do not keep the patient just bedridden, because the contact of the skin to the mattress, and if it's summer, it's very hot, the skin gets blistered and the skin gets broken, and the urine and the stool and the sweating get into the skin. By the time you realize, it gets into the blood, and that is called what? Infection. Another problem we see that when people are bedridden and they have to feed them, they feed them lying down. You have to prop them up and you feed them. Why? If you give them drink lying down, you feed them lying down, food will go into the lungs. And when food gets into the lungs, that lung infection. And when the food gets into the lung, they may not respond the way you and I will respond when you drink water and get to the lung. Why? Because all these reflexes are affected by the stroke. So you propped up the bed, and careful when you are feeding them, you make sure the food gets in the right area. But guess what? When they get another stroke, even feeding becomes a problem where vomiting comes now. As you put the food in, because the muscle to masticate the food have been affected by the stroke, they cannot chew and they cannot swallow. And I've seen patients trying to push the food in the mouth, and the food gets into the wrong place in the lung. And when you do an x-ray, you're going to see what? Infection in the lung. And they are already stroke, infection in the lung, fever. If not careful, that alone can make the whole recovery what? Difficult, and can delay the recovery. Stroke is a real problem. Is the leading cause of disability. What disability means, you become physically independent, right? You have to depend on other people to go to the bathroom, to eat, to drink, to sit up, right? And if you don't have that network of people around you to be helping you, listen to me, life become hell, right? And guess what? 80% of all the strokes can be what? Avoided and prevented. How do you prevent stroke? Minimize the what? Risk factors. Pressure high, bring it down. Overweight, bring it down. Diabetes all over the control, bring it under control. Smoking, quit. Drinking, stop. Lack of exercise, go on the road, starts walking. That's how you decrease the risk factors of developing stroke. Do not be a victim. Fight back. Say no to stroke. Our next video will be more interesting than this. We're going to talk about the eye, another complex organ in the human body. Eye, on the face, connected to the brain, right? So next to the brain, the eye is the most complex organ in the human body. And tomorrow, next video, we'll be talking how diabetes affects the eyes. Bye-bye. Hasta luego. Au revoir. See you later. Bokulaka. Losako. Dokotolo. Gombele. Bye-bye.